So I am performing a physical assessment on my patient. I've already explained the procedure, introduced myself. I'm going to now wash my hands. I'm first going to check him for any immediate signs of distress. All are good. I'm going to check his level of consciousness, his orientation. So I'm going to ask him his name, date of birth, where he's at, and what year it is. While I assess that, I'm going to check his facial expressions, his appropriateness of response, and his speech. I'm then going to do a head assessment. I'm going to check for good distribution of hair, any lesions, any discoloration, all are good. I'm then going to check his ears for shape, size, lesions, any drainage, and no assistive devices. I'm then going to check his eyes for any edema, discoloration, good symmetry, good size, good shape. I'm then going to check his nose for size and symmetry, any drainage, congestion. He has no glasses or contacts. I'm then going to check his mouth. I'm going to check his oral mucosa, his hard and soft palate, his gingiva, his teeth, his lips. No dentures are present. I'm then going to move down to his heart and lungs. I'm going to first check his carotid pulse for 1 minute on each side, palpating each one at a time. I'm then going to inspect his anterior chest, making sure that the bed is at 30 to 45 degree angle and in a supine position. I'm then going to locate and check his PMI. It's good. I'm also going to note for any use of accessory muscles, which he's not. I'm then going to check his 6 lung sounds on the front. So 1, 6. I'm then going to check the ones on the back, 10. I'm then going to ask the patient if he's having any coughing, sputum, shortness of breath, dyspnea with activity. No? Okay. I'm then going to move to his upper extremities. I'm going to check his temperature. Make sure he has good range of motion. Both arms. I'm then going to check his hand grasps, make sure they're equal. Good. I'm then going to check his brachial pulse on both arms, his radial pulse on both arms, and his capillary refill on both arms. I'm then going to move down to his abdomen. I'm first going to assess for any different contour, anything that would look strange as far as distension. All look good. I'm then going to listen to all 4 quadrants. I'm then going to lightly palpate each quadrant. And then I'm going to ask the patient if he's having any constipation, diarrhea, nausea, vomiting, when his last bowel movement was, any urinary complaints, and he has no catheter present, and how his appetite is. Good. So then I'm going to move down to his lower extremities. I'm first going to check his femoral pulse, his popliteal pulse, his posterior tibial pulse, and his dorsalis pedis pulse. I'm then going to check for any edema, discoloration, and Holman sign. Do you have any pain? No? Good. On both legs. Good. And then going to make sure he has good range of motion, dorsi and plantar flexion. Good. Okay. I'm then going to do a skin assessment. So I'm going to check all the skin, which I've done throughout the whole assessment. I'm then going to check for any tubings, so IV, NG tubes, feeding tubes, O2. All are good. I'm going to ask the patient if he's having any pain or discomfort. Check to see if he has any immediate needs. All are good. I'm going to make sure the bed's in the lowest position, the call bell's within reach, the table's within reach, and then I'm going to perform hand hygiene.